Okay, so we have review today, right? Over chapter 9, 10, 11. Okay, that will be for your exam on Thursday. Over chapter 9, 10, and 11. Now, for the chapter 9, what is about? Joint. So, for this joint, make sure you know the type of joint based on anatomy and physiology. Based on structure and based on function. Okay, based on structure, there are three types. Okay, there are three types. What is the first one? Fibers is mean that it's made of fibers. Okay, fiber join the two bones. Mostly the fibrous joints will be the function syn, amphi, or di. Syn arthrosis. So mostly the fibrous joint will be syn arthrosis, immovable. What is the second type of joint based on structure? The cartilaginous joint. It means that the cartilage join the two bones. Now what is the function will be? Mostly will be amphiarthrosis, slightly movable joint. What is the third type? Synovial joint. It means that it has synovial cavity. All the synovial joint will be diarthrosis. If you get this one, right now, you will be happy. Right? At least this one first. Right? Two types of joint based on structure, and then you connect that structure with the function. Right? Again, fibrous joint, mostly synarthrosis. The cartilaginous joint, mostly amphiarthrosis. And the synovial joint, mostly diarthrosis. Got this one? Oh, you're good. Now, the second one. Type of fibrous joint. Type of fibrous joint. There are three types. There are three types. First one, on the skull. All the skull have suture except the mandible. All the skull have suture. How many types of suture that you know? 4. How about the one between parietal bone? Sagittal, between frontal and parietal, coronal, between parietal and temporal, squamous, between the occipital and parietal, lamboid. You got that one? You get at least 4 or 8 points. You got this one? All the suture will be syn, amphi, or di. Syn. Immovable. Again, you got something there. Syn arthrosis. Now, the second type. The second type of fibrous joint between your jaws, whether lower jaws or upper jaws, and the teeth. Gomphosis. Gomphosis. This is syn, amphi, or di. Syn. It should be syn. Right? If this is amphi, you have problem. You got this, you okay for the exam. The last one, last one, the fibers that connect the radius and ulna and tibia and fibula. Syndesmosis. Now this is the one that slightly movable, amphiarthrosis. You done? You done with the fibrous joint. Second, cartilaginous joint. How many types? Two types. Right? 2 types. If it is hyaline cartilage that connect the two bones, the cartilaginous joint is called synchondrosis. 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 Example is between the sternum and the ribs. There is a synchondrosis. It is syn or amphiarthrosis? Syn. arthrosis, immovable. Okay. What is the second one? Symphysis. Symphysis. Okay. And the most famous location is between the vertebrae. Okay. Between vertebrae there is a disc. It's called the intervertebral disc, which is made of fibrocartilage, the strongest cartilage. The second location will be here in our pubic, between the hip bone. It is called a pubic symphysis. That's the name, because it's located in the pubic, then it's called pubic symphysis. The symphysis will be syn, amphi, or di. Amphiarthrosis. Okay. No, you got that one. There is somewhere between 10 to 12 points over there. So, get it? Now, the most maybe kind of, it's not that difficult, but if you learn it, it's going to be easy, right? Which is the synovial joint. Synovial joint. Again, this is the joint that everybody know, because this is the one that's actually freely movable. Okay, all the synovial joint will be freely movable. How many types? 6. There are 6 types. There are 6 types. Okay? The first one, let's say we start from the top, between the axis and the atlas. What you call that type of joint? Type of synovial joint. And we're gonna over here type of diarthrosis. What does diarthrosis mean? Freely movable joint. Type of synovial joint. First, between axis and atlas, we have a joint called pivot. Pivot joint. Example between atlas and axis. Now the pivot joint give you movement is called rotation. Rotation. Okay, you guys one? Now go down a little bit. We have this pivot joint. Let's say go to this in the shoulder, ball and socket. I will not put in order, but you should know. You should know ball and socket. This is in shoulder. What is the other one?
Your hip.
And hip joint. Now, what is movement that can be made from this ball and socket? Many, okay, which is most of angular movement, like it can do flexion, extension, hyperextension, right? Circumduction. Okay, you can do with this shoulder. What do you call this? Abduction. What do you call this movement? Adduction. Okay, so many movement can be done with this ball and socket. Okay, now going down here. Okay, let's go here to the elbow. We have joint called the hinge. For the hinge joint, it can only do the flexion and extension. Flexion, extension. Can you do hyperextension?
No.
No, it's broken. It will be broken. Let's say going down here between the finger, condyloid. This condyloid is kind of similar with the ball and socket. It has many movement. Even it can do the hyperextension, extension, hyperextension. What next? Here, especially in the thumb and the carpal over here, there is a joint that looks like a saddle. It's called a saddle joint. Okay, saddle joint. Okay, it can perform some extension, flexion. Okay. What is the last one? Planar or plane. Plane or planar joint. And this one is spatial movement only. Doing movement is called a gliding over here. Okay. Now, make sure you know this name of the joint and the movement that they can perform. Right? I will choose what type of movement and what type of joints in the exam, then you just kind of matching it or answer it with is correct or wrong, or choose which one is the correct answer for that one. Okay, that's for the joint. Joint. No, some special movement is actually performed with this joint because some area they have a special type of joint combination between these, and they can perform some special movement. Especially we talk about 4 special movement in the mandibles, between mandible and then temporal bone, and on the feet. Now, make sure you know this. Let's say, what do you call the jaw movement or the mandible movement when you move that jaw to the front? Protraction. How if you move it back? Retraction. How if you move it down? Depression. How if you move up? Elevation. That's for jaw movement. Now foot movement. What do you call if you move it medially? You move it to middle. Inversion. You move it out laterally. Eversion. You move it up to the dorsal. Dorsal flexion. You move it down to the plantar flexion. That's it. One more here. When you start from supine, go to the pronation. When you start from prone, go to supine, supination. Okay. You got this one? Okay. Last one for this is some disorder related to joint. Okay. First, when we get old, what happens? We will not produce the liquid. What do you call the liquid that produce in the synovial joint? Synovial fluid. Okay. Which structure produce the synovial fluid? Synovial membrane. Synovial membrane produce the synovial fluid. That synovial fluid carry the nutrients for the articular cartilage. You get it, one? So synovial fluid produced by synovial membrane is used for or carry nutrient for articular cartilage. Get it? Okay. If we do not produce that, what happened with the articular cartilage? It's become hard or die. When it is hard and die, then it's going to be difficult to move. Right? That's usually happening for many old people. Now, what do you call that disorder? It's called a... What is the name? All the disease that related to the arthrosis or joint is called arthritis, but there is several types of arthritis. Arthritis means joint inflammation. That's arthritis. Okay, joint inflammation, and most of the time it's painful. Okay, so the one that is caused by the lack production of synovial fluid is called osteoarthritis. Osteoarthritis. Usually older people have this. Because yes, this is natural process. We will produce less synovial fluid when we get older. That's natural. Right? Second, let's say someone live close to the wood. They've been bitten by specific type of tick, and that tick carry bacteria. It's causing to be stiffness on the joint. It's called the Lyme disease. Okay, Lyme disease. Lyme disease. Again, I am not following the order on your assignment. Okay, so make sure you do understand which one is Lyme disease, which is caused by the bacteria carried by the tick. And usually this tick is live in the wood which is carried from the deer. Get it? So bacteria causing this disease called the Lyme disease. Right? Number 3, there is a specific substance which is crystal. When it is too much in our body, it will be going down based on the gravity. Okay, gravitation is going down. That crystal mostly will kind of deposit on the joint of your foot. So therefore, maybe in the morning when you wake up, if you touch it, it's really, really painful. Anybody know what is the name of that disease? Gouty, Gouty arthritis. Gouty arthritis, caused by uric acid crystal. Why is attacking the lower part of our body? Because crystal, they are heavier, they will be going down, based on gravitation. The last one, this is autoimmune disease. The auto, what does auto mean? What is auto? Automatic, what does automatic mean? What is auto? Anybody know what is auto mean? Auto mean self. Automatic mean is doing it by itself. Auto. Auto means self. Auto means self. Now, immune. What is immune? What does immunity mean? Immunity means our ability to fight, fight infection. So we have we have immune system, right? We have immune system in our body. Remember, there are 11 systems. One of them is immune system, and this immune system usually done by white blood cell, and also by the antibodies. Okay, antibodies. Now, autoimmune disease means disease that is caused by our own immune system. So basically, our immune system actually attacking our tissue, kill our own tissue. That's what we call the autoimmune disease. Mostly, the one that attack our own tissue, there is a immunoglobulin. It's called the IgG. If you take this class with me, so we have the second section of this class. We're gonna talk about autoimmune disease. There are 5 types of immunoglobulin: IgG, IgA, IgM, IgD, IgE. The most abundant is IgG, immunoglobulin G, and this is the one that usually attack our tissue. Attack our tissue. And white blood cell over here, there are also 5 types, which is never let monkey eat banana, neutrophils, eosinophil, etc. So there is also called the neutrophil, which is a white blood cell. This is also attacking our tissue. So what happens if this attacking our tissue? It kill our tissue. there are some of them that attack our joint. Attack our joint, especially in this finger. In this finger. If it is attacking our finger, that disease is called a rheumatoid arthritis, or RA. So the joint can be really stiff and fused together. It's gonna be really hurt. Actually, I have friends that get the surgery from the RA. Right? And if it is attacking the backbone, most of you writing that one, which is called the ankylosing spondylitis. That's this one, joint in finger, ankylosing spondylitis. This is attacking joint in vertebrae. So if you write one of them, should be correct. Whether RA or AS, that's autoimmune disease. That attack joint. There are other autoimmune diseases that attack other body function, but right now, the one that attack the joint is called the RA or AS. You have question for this chapter? You done? If you get this one, you should get 1/3 of the exam. Maybe about what? Let's say about 20 points maybe over here. Right? Now, go to the next chapter, which is muscle tissue. For this one, first, know that there are 3 types of muscle tissue. How many types of muscle tissue? 3 types. The one that attaches to the skeleton is called skeletal muscle. The one that on the wall, on the heart is called cardiac. The one that's in the wall of the hollow organs, smooth muscle. Okay. From these 3, which one voluntary? Skeletal muscle. Which one involuntary? Cardiac and smooth. If you get this one, again you get 4 or 8 points over the way. Now, next, which one has stripe? Skeletal and cardiac. Right? Which one is smooth? Smooth muscle. Now, which one able to repair? Only smooth muscle. Smooth muscle. That the only muscle tissue that able to repair is smooth muscle. Therefore, if you cut, if your blood vessel being cut, for example, it can be repaired. It can stick together. So that's the smooth muscle. The rest, skeletal muscle, cardiac muscle, when it is die, it becomes scar. Scar tissues. Okay, you got that one, you will be happy. Okay, now, for the skeletal muscle, we learned about the structure, anatomy of the skeletal muscle, including the units. What do you call the units for contraction? What is the name? Unit for contraction. It's very important because that actually the one that is contract. Sarcomere. Sarcomere. So again, what is the unit for contraction? Sarcomeres. In the sarcomeres, we have several type of filament or protein. The one that used for contraction, there are 2. It's called the contractile proteins. It's good to your, let's say, number 13. Number 13 or page number 6 on your assignment. 3 classes of muscle proteins. The first one is called the contractile proteins. Contractile proteins. Or filaments. This is the one that doing the contraction. There are two. What do you call the thin one? Actin. Remember thin. So actin, thin. What is the thick one? Myosin. Okay. The second one is called the regulatory proteins or filaments. This is the one that regulates the contraction, which is located in the actin actually, together with the actin. First is the one that receives calcium, or it has calcium binding site. What is the name? Troponin. It has calcium binding site. Okay. What is the second one? The one that actually cover the myosin binding site. Tropomyosin. Okay, this is the two regulatory proteins. Number three is structural proteins, which is the one that strengthens the sarcomere. It consists of nebulin and dystrophin. Nebulin, dystrophin. But for this, I just want you to focus on here. This one, the contractile and the regulatory, because this is the one that causing the contraction, which is actin, myosin, troponin, and tropomyosin. If you know them, you know their function, you will be happy during the exam. Okay. Now, what do you call the neurotransmitters that is released into the NMJ? So NMJ means neuromuscular junction, which is the junction between, which is this over here, the synapse, synaptic cleft. That's what called the NMJ, neuromuscular junction. What do you call this neurotransmitter that is released here? This is muscle cell. What is the name of the neurotransmitter? Acetylcholine. ACH. Acetylcholine. ACH. Okay. Get it? Okay. Now make sure also you know inside the muscle cell we have a special reticulum that's used for storage for calcium. What is the name? SR, sarcoplasmic reticulum. And we have special protein that carry oxygen. What is the name? What is muscle mean? Myo. What do you call the protein that carry oxygen? Mostly in the form of globular protein. Therefore, it's called the globulin. So myoglobulin, right? Myoglobulin. Sometimes, just myoglobin. You have hemoglobin in the blood, then you have also myoglobin in the muscle. Okay. What do you call the storage of sugar or glucose in the muscle? Called the glycogen. This is actually storage of sugar in the muscle. We have a lot in muscle and also in liver, glycogen. Okay. Got this one? So make sure to take a note. Myoglobin, glycogen, SR, and then these 4 proteins over there, or filaments over there. Okay. Okay, do you have questions so far for this muscle tissue? What do you call the cell membrane of muscle tissue? Sarcomembrane. There is no sarcomembrane. Sarco? No, the membrane. Huh? Sarcolemma. Sarcolemma. What do you call the plasma? Then sarcoplasma. Sarcoplasm. Okay. Sarcolemma, sarcoplasm. Okay. I think that's all for muscle tissue. That's all for muscle tissue. For muscular system, okay, muscular system, I suggest you to watch the video that I made in the lab. Okay? Mostly that muscle, the one that will be in the exam. Okay? Like for example, muscle in your head. What you call the front muscle over here? Frontalis, temporalis, occipitalis, and occipitalis. Now, muscle of the face, muscle of the face, okay? The one that circle the eyes, orbicularis oculi or oculis, the one that circle the mouth, orbicularis oris, okay? The one on the cheek muscle, zygomaticus, right? This big muscle over here, the one that masseter. Under the masseter, if you take out masseter, there is a muscle that help you in whistling and saxophoning. Vaccinator. Okay, got it? Okay. Now, again, neck muscle. The muscle used for movement. There are several muscles. I just need one. The one that move your head. This is from the back, okay, from the temporal bone to your sternum. No. Back over here to the sternum. That's what the name is start from with the sternum. Sternocleidomastoid muscle. Sternocleidomastoid muscle. That's the one that moves your head. You with me? Okay. Now over here, okay, when you talk about in the front part, that's the platysma. On the back, look like a kite or diamond. Trapezius muscle. Okay, that's enough for the muscle of the neck. Get it? Now, muscle of your body, we start from the front. Oh. Okay, not the front here. Okay? Here, what do you call this muscle? Do I have to open my eyes now? Pectoralis, okay? Pec muscle. Okay, pectoralis muscle. Right. Hey, on the back, over here. Latissimus dorsi, because it's a dorsal part. So you have the latissimus dorsi over here. Right? So you have pectoralis, you have latissimus dorsi. Right? That's the main muscle in our trunk. If you take out the pectoral muscle, you're gonna see muscle between the ribs. What you call the muscle between the ribs? What is rib? Costa. So it's gonna be intercostal muscle. There are two, external and internal. We're gonna talk about this on the second section of this anatomy and physiology. When we talk about respiration, this intercostal muscle is really important. Right? Okay. Now on the front, we have four. Okay, ab muscle. Right? What you call the first one on the outside, on the lateral, that obliquely going down, external, oblique, and under it there is also oblique muscle that going up, internal oblique, and at the last layer, under the internal oblique, there is a muscle that transverse, cross, called the transversus abdominis. It is on the lateral part. In the middle part, this is the six-pack muscle. What you call that? rectus. Rectus means also straight. Okay? Rectus abdominis. Okay? That's the trunk muscle. Okay? You have that. Pectoralis, latissimus dorsi, and then the abs muscle plus the intercostal muscle. Okay? Now, muscle in the arm over here. Upper limb. Start with the big muscle here on the shoulder. No, here. Deltoid, right? And then on the front, on the supine area, bicep. On the back, tricep, right? And then over here, you have a group muscle that can pronate your arm. Therefore, it's called the pronator. And then also group of muscle that can flex your hand. Therefore, it's called flexor. Right? So you have pronator and flexor muscle over here. On the back, you have muscle that supine your arm. Therefore, it's called a supinator. And the muscle that extend your hand is called a extensor. Okay? Group of supinator, extensor on this back. Okay? That's done. Now on the leg, which is lower limb, start with the butt muscle. There are 3 layers. What is the big one? Maximus. What is the medium one? Medius. And then if you have to take out the maximus in order to see the gluteus, the minimus. Right? That's the butt muscle. Right? Here on the thigh, you actually have 3 compartments. 3 compartments. Right? The front and the lateral. This is big compartment because from the front to the side. Right? That compartment consists of muscle called the quadriceps femoris. Okay, quadriceps femoris. There are 4 groups over there, which is the, what is the first one? Rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis. Right? 4 muscle over here. All of them is called the quadriceps femoris. The back, we have another group. It's called hamstrings muscle. There are 3, which is biceps femoris. What is the next one? Semitendinous and semimembranous. 3. Now the rest, which is in the middle part of your thigh, is called, all of them is called the adductor muscle because it's adduct your thigh. Adductor muscle. So these 3 components of the thigh, quadriceps femoris, hamstring, and the adductors group. Now on the the leg over here, on the front part, we have the biggest one is called the tibialis anterior. On the back, we have also bigger one. It's called the gastrocnemius muscle. If you know that, you're done. You should be good. Okay, so that's the muscle of our body. And again, to study more, watch that video because I show what is the location of that muscle on that video. Right now, I cannot show it because I don't have that muscle. My muscle is small. And the last one, there are 3 muscles. Remember when you give drug or medicine, the best way, what is the best way to give medicine actually? What is the best way that medicine can reach your tissue right away? What is the first one? What's the first one? The best one? Yes, the IV. No, that's number 2. What is the best one? IV, intervascular. Using, injection to your blood vessel, mostly the vein, right? The vein. But it's painful, it's not good, okay? It's not easy, right? Therefore, we have a second better way to deliver the drugs into your body. What is that? The IM, intermuscular injection. Better than the IV. The IV, I scare even even just to get the injection. IV even more scary. IV number one, second is IM. Now there are 3 locations on your muscle that use for IM injection. What is the first one? Okay, you can see radius medius over here, deltoid, and vastus lateralis. Is that correct? Okay, that's 3 locations of muscle. What is the last way to deliver your drug, the medicine? It is not that effective, but for me, I like it. Oral, okay, oral medication. It's not that as effective as IV or IM, but still good. Using oral. Most people using oral. You choose oral better. You will not be injected, your Advil or whatever directly to your body. Okay, you get this one? Anybody have question for this? If not, we done, and good luck with your exam. So exam will be here at 9:30 on Thursday.